Good morning everyone, this is EKTA Singh of class 11th from St. Martin's Diocesan School. Today I'm gonna present a special report on the World Population Day. World Population Day is an annual event that is observed on 11th July every year across the world. It is celebrated to increase awareness among people towards population issues. It was first started in the year 1989 by the United Nations Development Programme and has been celebrated since then. The largest countries in the world in terms of population are China and India, with both countries now having populations of well over 1 billion. The United States comes in third with just 325 million residents. As the COVID-19 pandemic rages around the world, governments are taking unprecedented measures to limit the spread of the virus, ramping up health system responses and announcing movement restrictions affecting millions. But amid these efforts, policymakers must not lose sight of the vulnerabilities of women and girls, which have been exacerbated by the crisis, says a UNFPA, that is United Nations Fund for Population Activities, guidance note. Diseases outbreaks affect women and men differently, says the new UNFPA guidance document, which covers how gender is playing a role in the unfolding pandemic. Pandemics make exiting gender equalities for women and girls worse and can impact how they receive treatment and care. Women may face heightened risk of exposure to COVID-19 due to their disproportionate representation among healthcare and social service personnel. Around the world, around 70% of health and social service workers are women. Many are midwives, nurses, or community health workers, roles that place them on front lines of any disease outbreak. Risks to women and girls also increase if health systems divert resources from sexual and reproductive health care to respond to the epidemic, and if the supply lines begin to crack under the strain of the pandemic. Sexual and reproductive health services and commodities are often overlooked in the times of crisis, yet women continue to require family planning, menstrual health supplies, and maternal health care. Already, countries have seen health systems forced to allocate staff and resources towards critical services and away from other areas of care. It is particularly worrying time for women who are pregnant and in need of routine health services. Infection control measures must be taken to protect women in antenatal, neonatal, and maternal health units. Pregnant women also need access to reliable information and quality care. To date, there is no evidence that pregnant women are at higher risk of severe illness from COVID-19 on present with different symptoms, said UNFPA Executive Director Dr. Natalia Kanem. It is important to ensure that all pregnant women with suspected, probable, or confirmed COVID-19 infection continue to have access to the full range of quality health care. Pregnant women with respiratory illness must be treated with utmost priority due to increased risk of adverse outcomes. All of these vulnerabilities are exacerbated in humanitarian settings. For the nearly 48 million women and girls, including 4 million pregnant women, were identified by UNFPA as in need of humanitarian assistance and protection in 2020. The dangers that COVID-19 offers possible, the magnified, the guide says. In addition to advocating for gender-sensitive responses, UNFPA has been providing material support to affected health systems. For instance, in China, UNFPA has distributed sanitary napkins and adult diapers for vulnerable populations, including at-risk elderly people, as well as personal protective equipment for health workers. At last, it is imperative that we support all the heroes of every country, that is, all the people working in the health sector, especially the frontliners risking their health and safety in this emergency. They need to be protected from infection.